So I wanted to welcome you all to today's Lunch and Learn event, our first one in this series. Dr. Lynn Johnson, who is SHRM and SCP Senior HR Consultant. Today she's going to talk with us about employers and employees' fears about returning to the workplace and finding calm in the storm. Dr. Johnson provides human resource management consulting services to small and medium-sized organizations and has 20 plus years of management and human resources experience, both in corporate and academic arenas. She works closely with clients to determine the best means of achieving the highest levels of performance for their organization. And she has been truly wonderful to work with throughout this and is a gem for providing these seminars for us this next 4 Mondays. So without further ado, I'm going to hand over the program to Dr. Lynn Johnson. Take it away, Lynn.
Good afternoon, everyone, and thank you, Amanda, for that introduction. Again, good afternoon to everyone, and welcome to today's Lunch and Learn with me, Dr. Johnson, and I'm excited to be spending the next 30 minutes with you. So I don't want to prolong the time, so I'm just going to jump right into it. Today's topic is going to be fears of returning to the workplace, as Amanda has stated, finding the calm in the storm, right? Finding the calm in the storm. So, who am I? Well, I am the owner of Triumphant HR Solutions, an HR outsourcing and consultant firm for small businesses. I work with business owners to basically lighten the load for them so that they can concentrate on things that's most essential to their business, like strategy development and things like that. I've been in the management arena and HR arena for approximately 20 years. And for about the last 9 years, I've been in the academic arena, where I also teach and train our young people in business and a different array of topics. But most of all, I love HR. And I believe that HR is where the heart of the organization resides, right? The heart of where the organization resides. But enough about me. Think about it. I want you to think about this real quick. Temperature checks, plexiglass, mounds of hand sanitizer, social distancing, and the end of remote working. For some of us, this can cause many emotions. It can cause fear. It can cause disbelief. It can even cause anger for some of us when it comes to returning to work. Now, research shows, and I've done quite a bit of research, but the one I want to point out is that 80% of state and local public employees fear contracting the virus if they actually come back to work. Now, that means that there is a great chance that your employees, the people who you know, the people who you are with on a daily basis, lack the confidence to return to their offices or even to your work site. So what are you and your HR team going to do to ensure that you are being proactive, that you guys are being strategic, and that you're being thoughtful in your approach to actually create this culture that we need today, a culture of certainty, a culture of confidence, and a culture of safety amidst all of this uncertainty and this fear that we are dealing with? And guys, let's be honest, this is something that is very real to us. Very real to us. So today, for the next 20 minutes, I hope to provide some additional insight to you that can help you address these fears that you may be dealing with already currently, or that you plan to deal with once you reopen. So we're going to cover some employee as well as some employer fears. We're going to look at some quick ways to manage these fears, but I also want to kind of reiterate some employee rights that I feel are very, very important as well for us to kind of go over for the next few minutes. Now, it's probably safe to say that everyone wants the coronavirus to go away. If I could tell you to raise your hand if you want the coronavirus to go away, how many people will raise their hand? I know I am. I'm ready for the coronavirus to go away. And it's also safe to say that we are actually worried about the risk to our health and the risk to the health of the people that we love. But these two things, they kind of conflict, right? They're conflicting interests. So there's no surprise that even our own country is split between the people who believe we should go back to work and get things going again, and also the people who believe that we should stay at home. But today I want you to understand that the key to actually figuring all of this stuff out is figuring out how to manage your employees, their fear during this uncertain time. So, but before we talk about actually managing the fear, I want us to take a brief look at some of the common fears that that our employees deal with, and also the common fears that we as employers actually have to deal with. Now, most can agree that getting back to work is ideal for some of us. Let's face it, some of us haven't been at work. Some of us may have been unemployed. So there's a lot of things that go into not being able to go back to work. But fear is holding a lot of companies back. Fear is holding a lot of companies back from actually opening their doors. And is it real? Is it something that is important and that we must address? Yes, because the number one fear of everyone, that's including you and that's including me, and that is contracting the virus. That's the number one fear. I don't care where you go to research, it's the number one fear. Just in Polk County alone, I looked at the numbers. Has anybody looked at the numbers this morning for Polk County? 400, I hope I'm right, 494 additional cases in Polk County. 494. And in Florida, over 22,000. So this fear, guys, is real. This virus keeps spreading, it keeps rising. Also exposing our family members. We all have families. We all deal with our families who may be a person that if they contract COVID-19, it really affects them even to death. So we are very concerned about this. Employees are feeling that their work environment can actually create an opportunity for them to actually contract the virus. But guess what? Some of our employees may be asymptomatic, right? They may not have any symptoms, but they may not even know that they have it, but they could actually take it to someone who is not. And it could be very, very deadly for some. This last point I put in there about a couple of days ago, schools not reopening. That has been a hot topic for us in the nation and also for us even in Polk County. Parents are concerned that their children may have to continue to be at home when they actually have to be at work. Now, as a parent, I'm also concerned. I'm very concerned about this. I don't know how many parents we have on the line that have students in the Polk County school system, but I got a message, I believe it was last week, from the Polk County School Board that actually said that they are limiting the number of students that can actually ride the school bus. Now, how many of your employees leave work before their children have to go to school and are at work when school is over? Quite a bit of them, right? So this creates a problem not just for your employees, where they have to take their child to school, or to actually pick them up from school, but this creates problems for you, the organization as well. Think about it. Changes in workload, staffing challenges during these times. These are things that you are going to have to address, and you need to put a plan in place before August gets here. And you need to understand who your employees are that have small children that may decide that they are actually going to go back to school, but they can't ride the bus, or they don't have a means of transporting them to school, and they are the only means to do that. So we have to make sure that we are abreast of that as well. Now, what are some common fears that you may be experiencing? And some of you may be sitting there saying, well, I don't think we really have a whole lot of fears. Yes, you do. Deep down inside, you have fears. And I think the most prevalent one is the fear of actually providing a safe workplace, because it can be stressful. I'm sure it is stressful for many of you. And not only do you have to do your job, not only do you have to manage your own workload, you now have to deal with COVID-19 on top of all of that. Just think about it, all of that. So let's be honest, it's been quite stressful, and it's going to continue to be stressful to make sure that you guys are necessary, that you're taking all the necessary precautions to keep your employees safe. But understanding that you have this fear is actually really, it's good, because it makes it allows you to really work hard at keeping your employees safe. What about complying with this consistently changing laws when it comes to COVID-19? The consistent changing of the CDC guidelines and all of these things, the things that we have been dealing with. It's important for us to follow all federal, state, and local guidelines, but come on, again, let's be honest. How do we keep up with it all? How do we keep up with the updates and the changes to the COVID-19 protocols? They can become very overwhelming. My advice to you is to stay in contact with people like your chamber. The Winter Haven Chamber of Commerce, Amanda and Katie and all of the ladies and all of the people that work with them, they have done a great job with keeping us up to date with all of the different changes and all of the different challenges that we are all seeing. But let's take it a little bit further, even in your own places of employment. Try your best to have weekly debriefing meetings with your staff, right? Try to go over all of the new updates, all of the new mandates that's coming about. These weekly briefly meetings doesn't have to, it can be Zoom. Of course, I'm sure some of us are saying, I am zoomed out, but it can be from Zoom meetings to weekly emails, whatever you decide to do. Make sure that everybody is aware of all of the different changes that are consistently happening. We all need to be updated and educated, all of your employees. Last but not least, and this is very important, is that research shows that employers, companies anticipate seeing an increase in workplace claims and lawsuits. Now, specifically, I'm just going to mention 3 areas. Are there other areas? Yes, but I'm going to mention 3 areas: leave of absences, unsafe working conditions, and workers' compensation claims. Come on, let's think about it. Leave of absences. Well, we all know, because most of us are probably HR professionals, or we deal with this a lot. Leave of absences are based on individual circumstances that temporarily prevent an employee from actually working. Now, this could be due to them taking care of themselves. This could be due to them taking care of a family member who may have contracted the coronavirus. So we have to be aware of our leave of absence policies. What about unsafe working conditions? Now, an employee can claim that there's unsafe working conditions. However, we all know it has to be proven that the employer is not following the CDC or the OSHA guidelines. But I want to be open with you and just to let you know that if we as employers, business owners, HR professionals, managers, supervisors, if we create an environment where an employee can feel comfortable reporting that they feel that their work environment is not safe, this can go a long way. It goes back to what I said in the beginning. How can you create a culture of certainty? That's communication, right? And lastly, workers' compensation claims. There is a question out there. Well, if an employee claims that they contracted the virus while at work, can they apply for or file a workers' compensation claim? My answer to that is it's very complex. There's no yes, and there's no specific no. Every situation is different, but we must agree that COVID-19 presents a unique circumstance where many jobs that are not typically hazardous have now, after COVID-19, have become very hazardous. So we know, we hear a lot about these essential workers, right? Your grocery store workers, your healthcare workers, your mass transient workers. All of these workers are our essential workers, but they are at high risk of exposure. But the more hazardous working conditions does not necessarily guarantee that COVID-19 would actually be covered under workers' compensation. So what do you do as employers, business owners, when you come across these claims or potential lawsuits? What do you do as HR professionals? What do you do as supervisors? Well, you need to consult your HR professionals, but you also need to be in contact with your employment lawyers, right? To ensure that you are in compliance with every COVID-19 related decision. That's every COVID-19 related decision that you make, so that you make sure that you are not violating your employee rights and that you're always keeping your employees safe. Now, we talked about some common fears. How do we manage it? Let me tell you a little story I read the other day. Ken, who's a lawyer, he received a call from a manufacturing client. An employee wrongfully, I want you to listen to the words here, wrongfully believed that a worker on the same production line had tested positive for the virus. As a result, more than 24, hear it again, 24 workers walked off the job before quitting time. And worst of all, they said that they were not coming back the next day. But the company had taken all anti-COVID-19 measurements that they could. But fear, gossip is something that is hard to combat in our workplaces. Let's be honest. Words travel fast. Think about if you are a small employer, you only have maybe 4 to 5 employees. Somebody gets sick and has to not be able to come back to work. Somebody's going to put 2 and 2 together and get 4, right? Well, the workers had heard that a family member of an employee on a separate production line tested positive. The company did what it was supposed to do, like most companies will do. They shut the line down, they sent the workers home, they started cleaning and sanitizing the equipment. But what should the company do about the workers who actually walked off the job from that original line? Before I answer that question, fear is this new frontier that we as leaders, you as leaders, must actively manage. We have a long journey ahead of us, a long journey. It's going to stretch everyone. But we have to collectively be stronger than the fear. Someone, I'm sure it's someone of importance, I know I didn't come up with it, but somebody said, if fear wins, we can't win. Right? If fear wins, we can't win. So I'm going to give you about 5 tips that can help you manage your employee fears. So if I go back to the quick story that I gave you, one of the first response to a situation like this is communicate, communicate, communicate. Enhance communications. Focus on transparency. Provide frequent updates to employees. Do this to keep them safe. Set expectations and encourage a 2-way communication. The reason why most employers or companies don't get a handle on situations that get blown out of proportion is because they don't communicate, because they're not transparent. This is very critical, especially in small businesses. We have to be transparent with our people during a time when there is fear and this heightens this increase in fear and anxiety. We have to be transparent. We have to make our employees feel comfortable so that they can come to us with concerns. Next, I want you to deal with stress and anxiety head on, directly. Don't sweep it under the rug. Somebody comes to you or somebody hints at something, don't sweep it under the rug. Don't brush over it. Don't handle it correctly. Your supervisors, your managers should be trained on the warning signs of depression and anxiety, to be able to notice when these things happen. Now, I'm not saying they have to be medical experts. That's not what I'm saying. What I'm saying, train them on the warning signs, right? Train them on things to look for. Are they more combative than normal? Do they feel more reserved than normal? Have them understand what the warning signs are. Your management, your supervisors are going to be critical in this for you. Also encourage employees to take advantage of your EAP programs or your employee assistance programs. These can be a great resource during this time. Everyone on the call, on this virtual call today, I want you to understand that depression and anxiety is expected in a pandemic. If you go back and research every pandemic that has taken place, and there hasn't been that many, thank God, but think about the aftermath, the depression, the anxiety that comes from being in your home for long periods of time, the fear of getting sick, the fear of somebody dying. These things are very important to us. So help your employees understand the warning signs. Again, educate your employees. Educate your employees by providing reliable information. You want to provide a central location for them to get this information. You want to give them all of the lists, the national and local resources on prevention and self-care. You want to provide training to them as well on stress, but also resilience. And then update your policies and procedures. We all have them. So update your policies and procedures when it comes to handling depression and anxiety or fear. But here's what's critical. When developing your new policies, be sure to include everybody. I like to say include all your stakeholders, include your HR professionals, include your supervisors, include your employees, include safety people that you have in your organizations as well. And then last, be understanding of employees who aren't ready to come back to work. Have a conversation. Don't make employees feel like they're alone. The biggest challenge for you today is going to be recognizing and overcoming these psychological and these emotional challenges that you're going to come up with. And nobody is going to be able to do all of what we just talked about in every situation. All of the things that we just talked about is not, it cannot be handled. It's not going to encompass everything that needs to be done for every single employee in every situation that you have. But if your managers, your supervisors, yourself use these tips as a guide, it could really, really help you. So my question to you is, how do you show up for your employees every day when it comes to fear and managing this fear? You do this by offering a support system, but also offering empathy. Last but not least is the employee rights. Look at the list, you all know them, right? Family First Coronavirus Response Act, Americans with Disabilities Act, OSHA guidelines, National Labor Relations Act. When we see the Family First Act for coronavirus, this is a familiar act. We've seen it so much lately. Some of you have probably memorized this because you know it so well. You've been working with it for the last few months. And we all know what it is, right? We know what it entails. We know that it protects employees who are ill, who are trying to be diagnosed for the coronavirus, who may have families that are affected. So be sure that all of your supervisors or people who deal with your employees are trained on it. ADA, that's important during this time because ADA allows accommodations, and we know this. Well, what are accommodations for people who have underlying medical conditions? In the time of COVID, that can be working from home, that can be plexiglass, that can be barriers, that can be so many different things. But a conversation has to take place on how to do that. And OSHA, they set the PPE standards, the personal protective equipment standards. So we have to make sure as employers that we are meeting all of the requirements when it comes to this. Real quickly, I just want to read OSHA's statement that I think is very important for us to understand. OSHA says that an employee can refuse to work if they reasonably believe that they are in imminent danger. However, for this protection to apply, they must have a reasonable belief that there is threat of death or serious physical harm that's going to occur immediately or within a short period of time. But here's where it changes. It has to be based on fact, meaning it has to be proven. It also has to be determined that the employer cannot address the employee's specific fear in a manner that is designed to ensure a safe working environment. What does that mean for you? That means that you need to be abreast of your employees' fears and how to manage these fears and address them quickly, so that they do not get blown out of proportion. And then the National Labor Relations protects employees from disciplinary actions. This is important because when an employee says that they don't want to come to work, we may think that we want to discipline them or whatever the situation may be. It's different for everybody. But be sure that your managers and supervisors are trained on these laws, these acts, so that they know how to handle them. But remember, honesty, care, reassurance can go a long way with our employees. And it looks like, oh gosh, we're already at 12:26. The time just flies, flies, flies. So is there more? Yes, there is so much more, so much more. And we're all kind of antsy about returning to work. And this can bring on a feeling of confusion, mix of emotions. On one hand, returning to work can help strengthen our economy and our own finances. But on the other hand, it does bring about stress and worry. And we have to be aware of that. So it's up to us to find ways to set proper expectations to help our employees manage their fears, to be, and if we do it right, when we do decide to open back up, or if we've already opened back up, we can make sure that we are confident that we're doing it in a productive manner. And most importantly, we have to continue to remind employees that this too shall pass. No pandemic lasts forever. Giving people hope is one of the best ways to manage fear. And that's a lot. And what, 20 minutes? So I'm going to open it up for any questions. I do understand that we only have a few short minutes, but guess what? There is no one size fits all for any organization. There are so many variables that go into just managing an employee in general, especially dealing with fear, that I'm open for anybody to contact me for one-on-one consultation. I'm open to actually do training sessions for you and your employees on any topic dealing with HR and the COVID or whatever that you may have that you need. Reach out to me. I'm available for you. That is what I'm here for. Thank you, Amanda Joe, for allowing me this opportunity. And though there's so much information, I'm so sorry. I tried to rush through it quickly, but until the next time, until next week.
You were totally fine. Lynn, thank you so much. This was really amazing. I'm taking pages of notes here. And of course, anybody that's still on the line here, if you have any questions, I'm sure that Lynn's happy to address them. You have all of, I'm going to move it to gallery view so we can take a look. And if anybody has anything, please contact Dr. Johnson. She's amazing to work with. We do have another 3 sessions in the series next Monday at noon. Dr. Johnson's going to cover some remote working scenarios and see how that fixes us as employers and again employees. I had a question, Dr. Johnson, about policies. I know that I think just about every organization I've ever worked for constantly says, you know what, our policies are out of date. We really need to review them, and we never seem to get around to time to doing that. Is that something that an organization can reach out to somebody like yourself to come in and actually work with them to specifically review their HR policies?
Yes, definitely. We deal with so many different duties that we have as professionals, that you're right, there's no time to get it all done. Yes, that's why you contact someone like myself in order to actually sit down, have a conversation, and come and help you come up with the different policies and put them all together for you in a nice little handbook.
Yeah, because I think every organization I've ever been involved in has the handbook, have policies, most of which were probably written in 1978, and everybody's going to get around to doing them at some point, and nobody ever does, and then the next year comes around and it's back on the to-do list. But yeah, so I think that would be definitely in times like these. I think it's important that we work with professionals to make sure that we're adhering to all of the guidelines, and that when we're writing policies, they are up to speed, and they cover us as employers, and they're also the best guide for our employees.
And
sorry, say again.
Oh, no, I just want to add that that's another reason why I started my consulting firm. It's because we have a lot of small businesses who need help and who may not be able to go out and hire your top person that goes around and speaking and doing all of these things. And they need someone that's local. They need somebody that they can call on to. That's why I started my consulting firm, to actually help the small businesses do just what you're talking about.
Yeah. Thank you. We appreciate it very much. I know that mostly what happens in these webinars is people have questions, but they want to reach out to you direct, and we have your phone number. And of course, you all have my phone number that I can put you in touch with Lynn if you need to. Does anybody have any questions for Dr. Johnson before we sign off here? I want to be cognizant of everybody's time too.
Remember, it's not a one-size-fits-all, but I am open to one-on-one conversations with any of you. Just reach out to me.
Perfect. Well, I've got plenty of text messages and messages through saying thank you, Dr. Johnson. That was really great information.
Thank you.
And so hopefully we look forward to seeing everybody back here next Monday at noon. And you all have a wonderful week, and we will see you again. If I don't see you before, because we may see you in the networking showcase event on Thursday evening at 5, or coffee and conversation on Friday at 10 a.m. So whichever one works for you, and if not, we'll see you back here next Monday. Thanks again, everybody. Have a great week.
Thanks again. Bye-bye.
Bye.